Welcome to Collide Health's Medically Speaking. Each month, we'll explore a variety of topics to help you better understand certain medical conditions and treatment options. My guest today is Barb Sylvester, a clinical dietitian and certified diabetes educator at Collide Health. The new year is upon us, so today we'll be discussing some key points to following a healthy diet. I'm Mike Hughes, and this is Medically Speaking. Barb, welcome. Thanks for joining us today.
Oh, my pleasure.
So we're into 2019. New Year's is upon us, and people are into the New Year's resolutions. We'll talk a little bit more about the diet and things like that, and people wanting to get a fresh start. But if we can, start with your role as a clinical dietitian and what you do both in the inpatient and outpatient setting.
So in the outpatient setting, we have patients come into our clinic. We have a clinic at Buffalo General. We also have an off-site clinic on Hurdle Avenue. And when the patient comes in, we try to do an individualized meal plan with them. We'll have them keep a food record. We'll look at their medications, their medical conditions, or just healthy eating. We'll set up a meal plan for them. And we like to do follow-up visits with the patient as well. We also get patients coming in if they need surgery right away and they need some urgent weight loss for the surgery procedure. We will have them come in. Clinical, when we're inpatient, we're focusing more on the physical assessment of the patient, if they're malnourished, if they need fluids, if their skin is breaking down, they have surgical wounds, their PO intake, their medication interactions. We look more at the clinical side of it. We do some education in the hospital, especially if they're like newly diagnosed diabetes. Sure. We'll address that.
Sure. So again, it's 2019. People have made their resolutions. What do you recommend for a safe and healthy diet instead of the fad diets and things that maybe crash and burn type diets?
I would definitely recommend seeing somebody if you need some guidance, because there is so much information out there that is confusing. I would say the best thing to do is eat less processed foods. Like when you go into the supermarket, focus on the outer perimeter of the store. Your fruits, your vegetables, your meats, your dairy, the healthy foods. Those inner aisles are all processed foods. And we live in a very stressful society, so people are getting a lot of takeout because they don't have time. Nobody cooks anymore, so teaching your family how to cook, your children, nieces, nephews, because that is definitely a lost art, which I think is impacting our health.
Sure. Is there a one-size-fit-all type diet, or is there different recommendations based on health diagnosis, age, things like that?
It's definitely individualized. Good healthy eating, like I said, less processed foods, more fruits, vegetables, using herbs and spices in your cooking, those are all great. But a lot of people have different medications, different medical conditions, food allergies. If you fall into that category, I would definitely come in and see a registered dietitian, and we can help you straighten out all the confusion you might be getting online or hearing from friends or relatives. But I would say like a diabetes meal plan is probably overall in general very healthy. A lot of people think if they have heart disease and diabetes that they have to follow like 2 separate diets, but they really don't. It's just good, healthy eating, and it's those carbohydrates that I feel have the biggest impact on people's health.
Gotcha. You mentioned the term registered dietitian. Can you talk a little bit more about that and what your training is and your education is?
So a registered dietitian has to, 4 years of school, you have to have a bachelor's degree. You also have to take a state exam and be licensed. I'm also a certified diabetes educator, and that's also an exam and a licensure. A lot of people that call themselves nutritionists or health coaches, they don't really have the nutritional background.
Why is that so important to have the background or the training?
Because we really focus, that's our job, that's what we were trained in, and we focus on that. That's our priority. We get our education, a lot of my experience, even though I went through school for 4 years, working with people for 20 years with these health conditions is really how I've learned what is affecting people's health, what is not. I look at the fad diets, because my patients always ask me about those.
And they change year after year, so you have a good sense of what the new diets are and things like that.
So I'm definitely trying to stay on top of that.
Gotcha. We didn't talk much about exercise, mostly on the diet, but if you can give us a little snippet on exercise as part of what you recommend.
Yep, exercise is so important because if the patient's not exercising and they're eating minimal calories, they really don't, especially the elderly, probably anyone over 40 actually, your metabolism slows down.
Sure.
So you could be eating healthy, but the weight may not be coming off. Could be portion control too. But once you start working that exercise into your daily routine, you will notice the weight will start to come off much, much
But
quicker
is
for you.
exercise an impediment or a barrier? Because I would think at a certain age or a certain weight, patients or those who are dealing with this may be intimidated by that because they think they have to go to the gym or what are some basic exercises that you recommend?
Actually, if you cannot get to the gym or you have joint problems, like PBS in the morning has a show on called Sit and Be Fit. You can watch that show. There's a lot of chair exercises you can do, the resistance bands, just
Should've brought
even
'em
doing
today. We
leg
could have done
lifts.
that today
yeah,
right here.
Yeah, definitely.
Right.
I have a pedal bike, a desk bike in my office, so I have a lot of patients that have knee injuries, hip, spine, and they're like, I can't exercise, or they've had a stroke and balance issues, and I put the pedal bike out, and they pedal that, no problem.
Sure.
There's a lot of activities you can do if you don't want to go to the gym or even get out of the house.
Right, right. So in wrapping up, if you had to have one recommendation or one takeaway for the viewers out there, what would it be?
I would say definitely be mindful of what you eat. Be conscious of it. If you know it's cake or wings or pizza and you shouldn't be eating that much, have a smaller portion of that.
Sure.
But definitely try to pay attention, be mindful, eat slow, read the food label, watch the portion. Those are all good tips. And just take it one step at a time when you start a New Year's goal, because some people want to change everything at once, and that's not realistic.
Right.
But one step at a time.
Great advice for everybody as we hit 2019.
Yeah.
Thanks for joining me today.
Oh, my pleasure. Thank you.
I'm Mike Hughes. We'll see you next time on Medically Speaking.